Recognize the signs of heart problems before it's too late. Cardiac health is essential for overall well-being, and various signs can indicate heart and circulation problems. Recognizing these signs early can be crucial for preventing serious conditions and ensuring effective treatment. Understanding each of these signs and how they manifest is key for early detection and appropriate treatment. In this video, we will explore the major signs of heart and circulatory issues, providing clear, evidence-based information to aid in identifying and seeking proper medical care. Number 1. Chest pain. Chest pain is one of the most important and recognizable signs of heart problems. It can feel like pressure, tightness, burning, or sharp pain in the center or left side of the chest. This pain, often associated with angina, occurs when the heart does not receive enough oxygen, usually due to narrowed or blocked arteries. In more severe cases, such as a heart attack, the pain can be intense and may be accompanied by symptoms like excessive sweating, nausea, and shortness of breath. Chest pain may radiate to the left arm, neck, jaw, or back. It's crucial to seek immediate medical attention if you experience chest pain, as it may indicate a serious heart condition that requires prompt intervention. Number 2. Shortness of breath. Shortness of breath, or dyspnea, is a common symptom of heart problems, manifesting as difficulty breathing or a feeling of suffocation. This symptom can occur during physical activities, at rest, or even while lying down, often indicating heart failure, where the heart struggles to pump blood efficiently to meet the body's needs. Shortness of breath can also be linked to conditions like angina or myocardial infarction, where inadequate blood flow affects tissue oxygenation. Additionally, heart valve diseases or arrhythmias may cause dyspnea. In severe cases, it may be accompanied by swelling in the extremities, persistent cough, and extreme fatigue. It is essential to seek medical evaluation if shortness of breath is recurrent or severe, as it may signal serious issues that require immediate treatment. Number 3. Palpitations. Palpitations are sensations of rapid, irregular, or intense heartbeats, often described as skipped beats or racing heart. While often harmless, caused by stress, caffeine, or exercise, palpitations can also signal serious heart problems like arrhythmias. Arrhythmias occur when the electrical impulses that coordinate heartbeats are not functioning correctly, leading to an abnormal heart rhythm. Conditions such as atrial fibrillation, ventricular tachycardia, or premature contractions are examples of arrhythmias that can cause palpitations. Additionally, underlying heart diseases like heart failure or coronary artery disease may trigger these symptoms. If palpitations are accompanied by chest pain, shortness of breath, dizziness, or fainting, they should be evaluated by a healthcare professional, as they may indicate a serious heart condition that needs prompt treatment. Number 4. Dizziness or fainting. Dizziness or fainting, known as syncope, can be signs of serious heart issues, occurring when blood flow to the brain is temporarily inadequate. These sensations can be caused by various heart conditions, including arrhythmias, where an irregular heart rhythm disrupts efficient circulation. Another common cause is aortic stenosis, where a narrowed aortic valve impedes proper blood flow. Heart failure can also reduce blood flow, causing dizziness or fainting. Additionally, orthostatic hypotension, a sudden drop in blood pressure upon standing, can result in dizziness. When accompanied by palpitations, chest pain, or shortness of breath, these symptoms indicate an urgent need for medical evaluation. Identifying the underlying cause is crucial to prevent future episodes and protect cardiovascular health. If you are looking for a significant transformation in your life, you are in the right place. We present the SMOOTHIE diet, an innovative 3-week weight loss program that enables you to lose up to 30 pounds. With thousands of people transforming their lives, the SMOOTHIE diet has established itself as a reference in effectiveness and results. Led by health coach Drew, one of the leading figures in the fitness world, this program offers a proven and effective approach. To learn more about the SMOOTHIE diet, click the link in the description or the pinned comment. Number 5. Swelling in the legs, ankles, and feet. Swelling in the legs, ankles, and feet, known as peripheral edema, is often a sign of heart failure. This condition occurs when the heart cannot pump blood efficiently, leading to fluid buildup in body tissues. When the heart is weak, blood tends to accumulate in the veins, especially in the lower extremities due to gravity. This causes fluid leakage from blood vessels into surrounding tissues, resulting in swelling. Besides heart failure, other heart problems, such as valve diseases or cardiomyopathies, can contribute to edema. The swelling may be accompanied by additional symptoms like shortness of breath and fatigue due to fluid accumulation in the lungs and other organs. It is important to seek medical evaluation if swelling persists or worsens, as it may indicate a need for treatment to improve heart function and prevent further complications. Number 6. Excessive fatigue. Excessive fatigue, characterized by extreme and persistent tiredness, can be a sign of heart problems, especially heart failure. In this condition, the heart cannot pump blood efficiently, leading to reduced blood and oxygen flow to muscles and tissues. This results in a constant feeling of exhaustion, even after adequate rest. Additionally, heart valve diseases, cardiomyopathies, and arrhythmias can impair heart function, leading to fatigue. Heart-related fatigue may be accompanied by other symptoms like shortness of breath, swelling in the legs, dizziness, and difficulty performing physical activities. If excessive fatigue is frequent and lacks an apparent cause, it is essential to consult a doctor for a thorough evaluation, as it may indicate a heart condition requiring intervention. Number 7. Nausea or indigestion. Nausea or indigestion can be subtle signs of heart problems, especially during a heart attack, where they are often underestimated. While these symptoms are more commonly associated with gastrointestinal issues, they can occur due to reduced blood flow to the heart, leading to angina or myocardial infarction. In women, these atypical symptoms are even more prevalent during a heart attack. Cardiac ischemia, or lack of oxygen to the heart, can irritate stomach nerves, causing abdominal discomfort, nausea, or even vomiting. Additionally, heart failure and valve diseases can lead to fluid buildup in the liver and intestines, contributing to feelings of nausea and poor digestion. If these symptoms appear suddenly or alongside chest pain, shortness of breath, or other cardiac signs, it's crucial to seek immediate medical attention to rule out or treat serious heart conditions. Number 8. Excessive sweating. Excessive sweating, especially when sudden and without an obvious cause, can be a sign of severe heart problems, such as a heart attack. During a heart attack, the body experiences stress, activating the sympathetic nervous system and causing profuse sweating, often described as cold sweat. This excessive sweating happens because the body is trying to regulate its temperature while dealing with pain and reduced blood flow. Sweating may be accompanied by other symptoms such as chest pain, shortness of breath, nausea, and dizziness. Besides heart attacks, heart failure and arrhythmias can also cause excessive sweating due to the added effort of the heart to maintain proper circulation. If excessive sweating occurs with other cardiac symptoms, it's crucial to seek immediate medical attention, as it may indicate a serious condition requiring urgent intervention. Number 9. Persistent cough. A persistent cough can be a sign of heart failure, a condition where the heart is unable to pump blood effectively, leading to fluid buildup in the lungs. This buildup, known as pulmonary congestion, irritates the airways, resulting in a chronic cough. The cough can be dry or productive, sometimes accompanied by blood-tinged sputum. Besides heart failure, other heart conditions, such as valve diseases, can cause similar symptoms. The cough may worsen when lying down, due to increased venous return to the heart exacerbating pulmonary congestion. When accompanied by shortness of breath, swelling in the legs, or extreme fatigue, this symptom is a clear indication that the heart isn't functioning properly. Seeking medical evaluation is essential to determine the underlying cause of the cough and begin appropriate treatment to improve heart function and alleviate symptoms. Number 10. Pale or bluish skin. Pale or bluish skin, especially in extremities like the lips and nails, can be a serious sign of heart problems, indicating a lack of oxygen in the blood, known as cyanosis. This occurs when the heart isn't pumping blood efficiently, leading to poor oxygenation of tissues. Conditions such as heart failure, valve diseases, and arrhythmias can compromise blood flow and gas exchange, resulting in a bluish or pale skin color. Additionally, heart failure can cause fluid buildup in the lungs, impairing proper oxygenation and contributing to cyanosis. Pale or bluish skin, when accompanied by symptoms like shortness of breath, chest pain, and fatigue, indicates the need for urgent medical evaluation to address the underlying condition and improve heart function. Number 11. Difficulty sleeping. Difficulty sleeping can be a sign of heart failure or other serious heart conditions. When the heart doesn't pump blood effectively, fluid can accumulate in the lungs, a condition known as pulmonary congestion, which makes breathing difficult when lying down. This leads to symptoms such as shortness of breath and coughing, disrupting sleep. Difficulty sleeping can also result from arrhythmias, which cause palpitations and discomfort, making rest challenging. Additionally, sleep apnea, a condition where breathing repeatedly stops and starts during sleep, can be associated with heart problems and worsen sleep difficulties. If difficulty sleeping is persistent and accompanied by symptoms like shortness of breath, swelling in the legs, or chest pain, it is crucial to seek medical evaluation to diagnose and treat the underlying condition. Number 12, feeling faint when standing up. Feeling faint when standing up, known as orthostatic hypotension, occurs when there's a sudden drop in blood pressure upon changing positions, especially when standing up quickly. This can be a sign of heart problems, such as heart failure or arrhythmias, where the heart's ability to pump blood efficiently is compromised. The lack of a quick adjustment in blood pressure can lead to a temporary reduction in blood flow to the brain, causing dizziness or a fainting sensation. Additionally, dehydration, certain medications, and valve diseases can contribute to this condition. If the fainting sensation is frequent and accompanied by other symptoms, such as shortness of breath, chest pain, or swelling, it is essential to seek medical advice to identify and address the underlying cause, ensuring proper management of blood pressure and heart health. Identifying signs of heart and circulatory problems is crucial for overall health and well-being. From chest pain and shortness of breath to symptoms like palpitations and swelling in the extremities, each sign may indicate a condition that requires immediate medical attention. Paying attention to additional symptoms, such as excessive fatigue and changes in skin color, can aid in early detection of heart issues. Seeking medical guidance upon noticing any of these signs is essential for accurate diagnosis and effective treatment. By being well informed about these signs and their importance, you can take proactive steps to protect your cardiovascular health and ensure a healthier future. Thanks for watching until the end. Don't forget to like, subscribe to the channel and share with your friends.